Hi, my name is Presta, and I'm going to be talking about scoliosis and the spinal fusion surgery that goes along with that. It's a major medical procedure that corrects scoliosis and any instability in your spine after possibly having an accident of some kind. And the recovery after the surgery is just so hard and so long that it's very important that you have a strong support system with you. And that's why it's very important for people to have a good understanding of what this surgery is and kind of like the background of this surgery. And I personally also had the surgery to where I'm able to give a little bit more information on what this looks like for somebody in the patient's shoes. And I want to first I want to touch on like what scoliosis actually is, and that's going to be the abnormal curvature of your spine. You're going to have an S curve or a C curve, and an S curve is going to be 2 to 3 curves, and a C curve is just going to be 1. And here's an example of what an S curve will look like. And so you can kind of see the 3 curves, and I personally had a 12-degree curve here, a 58-degree here, and a 36-degree curve there. And so spinal curvatures are measured in a lateral curvature by a Cobb angle on an x-ray. And since it's a progressive deformity that affects your alignment and posture and your equilibrium, you are also getting x-rays every 6 months to a year just to like monitor that curvature and monitor that, make sure it's not getting too bad. And the severity and scale of this can be described by the Mayo Clinic, where they said that a mild curve is going to be 25 degrees and under, a moderate is going to be 25 to 40 degrees, and a severe curve is going to be 45 to 50 degrees and over that. And so I had a severe curve because mine was 58 degrees when I got my surgery. And it's recommended over 45 to 50 degrees to get that surgery as well. And so another big thing with this surgery and scoliosis in general is that before the surgery, you are going to be recommended to have bracing and like back braces. And this is kind of what a back brace looks like. And so you have these Velcros, and it's a hard plastic that is wrapped around you, and you wear this for about 22 hours a day. And it is very, very uncomfortable, but it is to help hold your body straight and stop your spine from having any room to move. Now, there are some downsides with this because it does cause pressure on some points of your body, and it's very uncomfortable. You can get bruised ribs, you can get irritations, rashes, and it's just not something that's fun to have. I only did this for 6 years before I ended up just giving up and then waiting until I had surgery. But this does work for some people, and this can help prevent the surgery in general from happening. It can cause your spine to stop curving to such a degree where it would be severe. It could just be moderate, and you could live with it forever. And so what happens in a spinal fusion surgery is it's going to be the permanent fusion of your vertebrae. It's going to eliminate motion between the segments. The bone graft is going to be placed between the vertebrae, and there's going to be screws and rods implanted along your spine to hold the spine stable. I had 3 curves, and I had 19 screws in place over 10 vertebrae, 2 titanium rods, and my surgery lasted about 10 hours, and a normal surgery is going to last about 8 to 10 hours. And it's permanent hardware in the spine. This does not move. This does not come out. This is in your body for good. And so it does play a big emotional and physical effect on the people that are getting the surgery and on those who are their support systems. And so the short-term recovery is going to be like your hospital stay. It's going to be like those 4 to 5 days that you're in the hospital, and maybe the beginning stages of you being at home, because when you're at the hospital, you're going to get post-operative monitoring to watch for bleeding, infection, and nerve complications. And then you're also going to relearn your mobility and what you actually still have left for mobility in your body. And you're going to do assisted walking because you're not able to do anything on your own at this point because you are in a lot of pain. And you also did just have your entire spine cut open. And so there are some long-term limitations that come along with this surgery as well, and that's going to include no jet skiing, no jumping out of planes, no trampolines, things like that, because you could fracture your spine. And this also includes roller coasters. Specifically with roller coasters, if you are driving, or you're on a roller coaster, and you hit like a turn and your legs turn and your body doesn't, you can fracture your spine and end up paralyzed. And you're more likely to get more hurt than anybody else is because of that. And so you lose a lot of your independence and resilience is built up during this surgery just because of how much strength is truly needed to be able to recover from the surgery and be okay after this surgery, because it's such a hard emotional toll to have on yourself. And I personally had experienced a lot of anxiety after the surgery. This is very common because you're not able to even sit up on your own or roll over in bed on your own. You're completely reliant on the people around you. And it's very, very hard for someone who was so independent before. And so I also have a picture of the befores and afters of surgery. So this is a spine before surgery, and this is a C curve because it does just have that one curve. And then this is what it looks like after. So you can see those screws, you can see those rods implanted, and that's what it looked like. And then this is going to be in this person's body for the rest of their lives. So they're not going to have mobility from this vertebrae all the way to this one. And mine personally goes from here all the way to the bottom here. And so I don't have any movement there. But you really don't notice it after, which is a plus of that. Spinal fusion is to correct the abnormal curvature of the spine. And my personal experience with this surgery highlights the long-term recovery needed, like being out of school, struggling with that, struggling with your mental health after, and all of that is very hard. To finalize my thinking on this topic, it didn't just straighten my spine, but it also strengthened my knowledge of my own strength and my own resilience, and that is a good part of this surgery. Spinal fusion isn't something to take lightly. It is the second most painful surgery in the world. It is something that is very, very hard for the people around them to go through and for the people that are going through this in general. A source that has been very helpful for my research on this topic has been the Journal of Orthopedics, the Mayo Clinic, and the Operation of Back Pain to Ease from the New York Times. Thank you.